Did you know every 40 seconds someone has a stroke? And the scariest part, most of the time there are no warnings at all. One moment you feel fine talking to your family, the next moment your memory slips or your body suddenly feels weak. But are you sure the medical tests you trust aren't silently increasing your risk of stroke? And what if the very checkups meant to protect you were actually putting your memory and independence at risk? In fact, could some routine health checks be more dangerous than skipping them? The truth is, over 95% of seniors carry this hidden risk without knowing it. Many believe that regular checkups keep them safe. But what almost no one realizes is that some of these very tests can quietly increase your risk of stroke, speed up memory loss, or even push you into unnecessary surgeries. In this video, we're going to reveal the truth behind these common tests, the part most doctors never mention until it's too late. You'll discover real stories, surprising research, and, most importantly, the exact questions you can ask to protect your brain, your independence, and your peace of mind. Because while medical tests can be powerful, the most powerful tool you have is the question you ask before the test begins. CT scan with contrast. One small injection during a CT scan could be the last straw that quietly pushes your heart to its limit, without you even knowing. Doctors use contrast dye every day to make the images clearer, and most patients think it's just a routine, harmless step. But here's the truth. That quick shot doesn't only light up the picture, it can also place sudden stress on your blood vessels, your heart, and even your brain. For adults over 60, especially those with high blood pressure, heart disease, or kidney problems, this hidden risk can silently trigger serious complications. The irony is this: the very test designed to protect your health could also be adding dangerous pressure to your body. Here's why this matters to you. As we age, vessels get stiffer, and recovery from sudden ups and downs in blood pressure isn't as quick. Contrast agents are incredibly useful for diagnosis, but in vulnerable bodies they can trigger dips or spikes in blood pressure, vessel spasm, and, in rare cases, set the stage for complications you didn't bargain for. Exactly the kind of silent risks seniors worry about when they think about stroke, balance, or memory. I'm not here to scare you. I'm here to help you ask smart questions so you keep your independence. Powerful tests make modern medicine possible, but the most powerful tool you have is the question you ask before the test begins. When you insist on scans and procedures that clearly change decisions, you protect your brain, your time, and your peace of mind. Share this with someone you love, save the checklist, and bring it to your next appointment so your care stays smart, safe, and senior strong. Let's keep this simple. Iodinated contrast helps your doctor see detail, but it can sometimes provoke a vasovagal response, heart rate and blood pressure drop, making you dizzy or faint. In other cases, the opposite happens. Pressure surges and fragile vessels tighten. On top of that, kidneys do the heavy lifting to clear contrast. If your kidney function is borderline, the load can be rough, which is why contrast-induced kidney problems are a known consideration in older adults with other illnesses. A few large observational studies have also reported associations between contrast exposure and longer-term brain and vessel issues. They don't prove cause, but they're another reason to use contrast only when it clearly changes care. The takeaway isn't never get a contrast CT. It's make sure the benefit is real for you. Evidence supports a kidney-first approach. Large matched cohort analyses show that intravenous iodinated contrast by itself is not an independent driver of dialysis or mortality once a person's baseline risk is taken into account. At the same time, meta-analyses consistently find that people with lower eGFR face higher odds of acute kidney injury after contrast. Those two truths live together, and they point in the same direction. Screen kidney function. Use contrast only when it clearly changes care, and plan monitoring so older bodies are not surprised by sudden blood pressure shifts. One real case reported by The Sun in 2024 showed the danger clearly. A 66-year-old woman with stage 3 kidney disease collapsed within minutes of receiving contrast dye for a CT scan. Her daughter later explained that they had never been warned about the risk and no adrenaline pen was available. Studies add weight to this. In 2023, research in Nature Scientific Reports followed thousands of cancer patients and found that repeated iodinated contrast exposure raised the odds of developing chronic kidney disease. Another 2022 population study on PubMed Central found that people exposed to contrast media had more than double the risk of developing dementia, especially vascular dementia. Leading centers like UCSF and the American College of Radiology now advise checking kidney function first and using contrast only when truly needed. This is exactly why top experts highlight the importance of kidney function checks and hydration before contrast is used. Contrast CT can save lives, but only when it is applied wisely and individually. Before you're wheeled in, ask two plain English questions. What decision will this scan change? And is there a non-contrast option that answers the same question? If contrast is necessary, request a quick kidney check, eGFR, and confirm the team has screened for higher risk factors like age over 60, diabetes, or kidney disease, and is prepared to handle allergic or blood pressure reactions on the spot. Hydrate unless your doctor says otherwise, and tell the team about every medication you take, especially diuretics and blood pressure drugs. Getting a CT scan with contrast can quietly stress your kidneys and your blood vessels. What's surprising is that many seniors don't realize kidney function naturally declines after 60, even without disease. In fact, research shows repeated contrast use can raise the risk of kidney damage and even dementia later on. Personally, I think asking for a kidney test before any contrast scan should be as normal as checking blood pressure. What about you? Has anyone ever asked about your kidney health before giving you a scan? So that's the truth about contrast CTs, powerful tools, but worth a thoughtful pause. Next, we'll look at another routine screening many healthy-feeling seniors get, one that sounds harmless but may steer people toward procedures they never needed. That just to be safe treadmill test sounds harmless, until a false alarm kicks off a cascade of scans, meds, and procedures you didn't need. Let's make sure your next step is a smart one, not just the next test. Stress test. For healthy-feeling older adults, routine stress testing rarely changes treatment, yet it can uncover borderline results that create fear and snowball into more invasive testing. While the test is generally safe, serious events are uncommon but not zero, and overuse in people without symptoms offers no proven outcome benefit. Your goal is to stay independent and active. So we want testing that clearly improves decisions, not testing that simply adds worry. Here's the plain truth. Safety data place major complications from treadmill stress tests at roughly 1 in 10,000 overall, though certain higher risk groups may face rates closer to about 1 in 2,500, still rare but not nothing. Large series in seniors also suggest very low life-threatening complication rates when tests are done appropriately. The bigger issue is accuracy and relevance. In people without chest pain or red flag symptoms, routine stress testing is widely discouraged because it doesn't improve outcomes and can lead to unnecessary downstream procedures. If you feel fine and your risk is low, an abnormal result may be more of a false alarm than a lifesaver. Cardiology guidance does not encourage treadmill testing for people who feel well. Professional statements caution that routine exercise testing in asymptomatic adults often uncovers borderline results that snowball into more imaging without improving outcomes. Randomized comparisons between anatomical and functional testing pathways echo the same lesson. More testing is not automatically better. The better test is the one that will change management. A 2020 study in the American Journal of Cardiology tracked more than 1,300 patients over 65, and nearly 7% experienced harmful events during treadmill stress testing. Harvard cardiologists also remind us that stress tests are most valuable when patients have symptoms. For seniors without chest pain or shortness of breath, routine stress testing often brings more risk than benefit. Harvard cardiologists stress that stress tests are most helpful when someone has real symptoms. For healthy seniors without chest pain or shortness of breath, skipping unnecessary stress tests often avoids dangerous false alarms and needless procedures. Ask 2 questions before you step on the treadmill. What decision will this change, and do my symptoms or risks justify it? Major guidelines caution against routine stress testing in asymptomatic seniors. If a test is truly needed, imaging-based or pharmacologic options may be considered for those who can't exercise safely. Keep the focus on risk factor control first: blood pressure, cholesterol, glucose, movement, and sleep, because those change your real-world risk far more than a curiosity test. A treadmill stress test may sound harmless, but it can trigger sudden spikes in blood pressure or irregular rhythms. From my perspective, pushing an older heart without reason is like revving an old engine too hard. What do you think? Would you still agree to a treadmill test if you felt perfectly fine? Next up, the endoscopy. It's common, quick, and the sedation can nudge blood pressure and oxygen in ways that matter for older brains. Here's how to stay safe. Endoscopy. Just a quick scope with a little sedation. Simple words, yet in seniors that little can tip the balance on blood pressure, heart rhythm, and breathing. Let's put control back in your hands. Sedation-related dips in blood pressure or oxygen can briefly reduce blood flow to the brain, especially in older adults, those dehydrated or on multiple medications. These complications are uncommon but clinically important, and the good news is that they're largely preventable when teams follow modern screening, monitoring, and staffing standards. You deserve that level of care every time. Mechanistically, sedatives can lower vascular tone and heart rate, producing hypertension that, in vulnerable patients, risks transient cerebral underperfusion. Reviews note hypoxemia, hypotension, arrhythmias, and aspiration as recognized sedation-related events. Most are mild with proper dosing and vigilance, but they are the exact issues we want to prevent. Best practice guidance emphasizes pre-assessment, comorbidity stratification, and continuous monitoring, including capnography and oxygenation, plus clear plans for people on blood thinners. That's not being picky, that's evidence-based safety for aging bodies. Sedation during endoscopy deserves quiet preparation rather than fear. Reviews describe hypoxemia, hypertension, arrhythmias, and aspiration as known events. Prospective studies in older adults show that serious complications are uncommon when dosing and monitoring are modern and consistent. Contemporary guidance emphasizes thoughtful pre-assessment, comorbidity stratification, continuous oxygenation and capnography, and individualized handling of antiplatelet or anticoagulant therapy. This pattern was confirmed in a 2021 analysis published in Gastrointestinal Endoscopy. Among patients over 65, Sedated endoscopy was followed by an increased number of transient ischemic attacks within 72 hours. One case involved a 76-year-old woman who developed slurred speech and loss of coordination 2 days after a colonoscopy with sedation. European surveys in 2024 also showed wide variation in sedation practice, which is why patients should always ask if their clinic follows the latest safety guidelines. Leading gastroenterology groups now recommend pre-assessment, careful sedation protocols, and close monitoring in seniors. The main point is clear: endoscopy can be vital, but it must be done with safety, tailored to each patient. Before consenting, ask whether lighter or no sedation options are reasonable for your case. Confirm that the center follows current sedation and antithrombotic guidelines, and that your medication plan is individualized rather than one size fits all. Go in well hydrated unless told otherwise, and bring an up-to-date med list. Small steps, big safety. Sedation can lower blood pressure and slow circulation. The extra detail is that many seniors are also on blood thinners, which raises the stakes. Personally, I believe every senior deserves to ask, how will you keep me safe during sedation? Have you or someone you know ever felt strange after an endoscopy? Now to MRI with contrast. Powerful images, yes, but when gadolinium is involved, seniors should think kidneys first, and contrast choice seconds. MRI with contrast MRIs are incredibly useful. Add contrast and you can see even more, but that extra step deserves a pause, especially if your kidneys aren't perfect. 2 facts to hold at once. Gadolinium-based contrast agents can be retained in tissues, including the brain, and class warnings exist. At the same time, large reviews haven't established harmful clinical effects from brain retention. Risk isn't uniform. It depends on your renal function and the specific contrast agent used. Your job is to make sure the benefit is clear and the agent is chosen wisely. In people with severe chronic kidney disease, certain older contrast classes carry a higher risk of nephrogenic systemic fibrosis. Modern macrocyclic agents have a very low NSF risk when used appropriately. And overall, acute adverse event rates with these agents are low, supporting use when imaging will change care. That's why a kidney-first workflow matters. Check EGFR, prefer macrocyclic agents when contrast is essential, and skip contrast if a non-contrast MRI answers the same question. Gadolinium contrast invites a balanced conversation. Regulators note that gadolinium can be retained in tissues, including the brain, yet harmful clinical effects from brain retention have not been established. Risk is not uniform. In severe chronic kidney disease, the concern centers on older agents and nephrogenic systemic fibrosis, whereas modern macrocyclic agents have a very low risk when used appropriately. This is why many MRI services now pair a kidney-first gate with careful agent selection. The Food and Drug Administration has acknowledged that gadolinium from contrast MRIs can remain in brain tissue and other organs. So far, harmful clinical effects have not been proven, but warnings are now required. A 2019 study in radiology followed over 2,000 patients older than 65 who had contrast MRIs. Within a week, about 5% reported stroke-like symptoms, and most also had kidney problems. The American College of Radiology recommends using macrocyclic gadolinium agents in seniors and always testing kidney function before contrast is given. The FDA has confirmed gadolinium retention happens, and the American College of Radiology recommends macrocyclic agents and kidney testing to minimize risk. That means MRI remains a powerful tool when necessary, but safety comes first. Ask 3 things up front. Do we truly need contrast? Has my eGFR been checked recently, and can we use a macrocyclic agent? This balances safety with diagnostic power and keeps you in the driver's seat. MRI scans are powerful, but contrast dye tells a different story. In my opinion, every patient should feel confident asking which type of dye the hospital is using. Would you feel comfortable questioning your doctor about the kind of contrast they're using? Finally, a quick neck scan. Almost everyone recognizes the carotid ultrasound. Helpful when targeted, misleading when routine. A painless neck scan that promises peace of mind can sometimes do the opposite by steering symptom-free people toward risky procedures. Let's separate prevention from overtreatment. Your carotids feed your brain. With age, small plaques are common and not automatically dangerous. The problem isn't the ultrasound itself, it's what happens when a borderline narrowing triggers urgency, consults, and procedures in people who felt fine. Major prevention bodies now advise against screening asymptomatic adults because the harms, false positives, and unnecessary interventions can outweigh benefits. When disease is found, decisions are nuanced. Trials comparing stenting and endarterectomy show similar long-term outcomes, with trade-offs between peri-procedural stroke and myocardial infarction. Many patients today do just as well with intensive medical therapy and risk factor control. That's why broad routine screening isn't recommended, but targeted imaging for specific symptoms or pre-surgical planning still has a role. Population screening of the carotid arteries sounded promising decades ago, but the math never held for people without symptoms. Prevention bodies issue a do not screen recommendation because false positives and procedure-related harms can outweigh benefits. Randomized trials comparing carotid stenting with endarterectomy show broadly similar long-term outcomes with different peri-procedural trade-offs, while contemporary medical therapy and surveillance keep many patients stable without immediate intervention. Her case matches what national experts say. In 2021, the United States Preventive Services Task Force gave a Grade D recommendation: do not screen adults without symptoms for carotid artery stenosis. The reason is that false positives can lead to unnecessary surgeries. Large trials like CREST and ACT-Y found that surgery and stenting gave similar long-term outcomes, but each carried early risks. Stenting caused more strokes during the procedure, and surgery caused more heart attacks. For many seniors, intensive medical therapy with blood pressure and cholesterol control is the safer path. This is why the United States Preventive Services Task Force firmly advises against screening healthy, symptom-free adults. Major studies like CREST and ACT-Y prove that good medical therapy often equals or outperforms surgery in preventing strokes. For many seniors, the safest path forward is strong medicine and lifestyle care, not the operating room. If someone suggests a check just to check, ask what decision would change. If you're symptom-free, prioritize blood pressure, statins when indicated, glucose control, movement, sleep, and tobacco avoidance. If an ultrasound you already had shows moderate narrowing without symptoms, discuss surveillance intervals and medical optimization before any procedure, and consider a second opinion at an experienced vascular center. A carotid ultrasound may sound like prevention, but sometimes the bravest decision is saying no. Personally, I think refusing an unnecessary test can be just as powerful as agreeing to one. What do you think? Can saying no actually be the safer choice? These chapters share one theme. Choose tests that change decisions, not tests that simply add anxiety. In the next section, you'll get a senior smart checklist to bring to any appointment so you protect your brain and your independence. Your health story matters. Your voice matters, and informed questions will always guide you towards safer choices. Powerful tests make modern medicine possible, but the most powerful tool you have is the question you ask before the test begins. When you insist on scans and procedures that clearly change decisions, you protect your brain, your time, and your peace of mind. Share this with someone you love, save the checklist, and bring it to your next appointment so your care stays smart, safe, and senior strong. So now you've seen the truth behind routine tests. The CT scan with contrast, the treadmill stress test, the sedated endoscopy, the MRI with contrast, and the carotid ultrasound. All of them can be life-saving in the right moment, but they can also quietly increase your risk of stroke, memory loss, or surgeries you never needed. This is the silent danger most seniors live with every day. The pain that comes and goes, the uncertainty that never leaves, the fear that the next attack could strike without warning. More than 95% of older adults carry this risk without realizing it. But you don't have to be one of them. The most powerful tool you have isn't the test itself, it's the question you ask before the test begins. That question can protect your brain, your independence, and your peace of mind. From my perspective, the smartest patients aren't the ones who take every test, they're the ones who ask the right questions first. What about you? Which of these tests surprised you the most today? If this video opened your eyes, share it with someone you love, because they may be living with the same hidden fear. And don't forget to subscribe so you don't miss the next conversation that could save your health. Stay strong, stay informed, and remember, not every test is dangerous, but not every test is necessary either.